that if we resolve this high insulin state that many people live in, we won't just resolve diabetes. We'll resolve we'll greatly reduce our risk for cancer, going back to the epigenetics concept. So we may be genetically predisposed to cancer, but if I'm not in a high insulin state, maybe my risk for cancer won't be as high as the family member who is in a high insulin state.
Welcome to the channel. I'm DC. Today I have a great interview for you with Dr. Tony Hampton. Dr. Hampton has quite an extensive history in the medical field and is a specialist in obesity and diabetes. He is also the author of the book, Fix Your Diet, Fix Your Diabetes. But while doing the research for his book, he came to the conclusion that the narrative on nutrition was all wrong. After changing his lifestyle and changing his diet, he is now a strong advocate for lifestyle management for not only preventative measures, but also for treatment of serious diseases such as diabetes. He is now also part of a larger group of doctors, including Dr. Ken Berry, Dr. Ben Bickman, and many others who are raising money now to start their own American Diabetes Society. So I hope you enjoy this interview. So again, thanks very much for joining me, Dr. Tony Hampton. I really appreciate you taking the time out of your very busy schedule. So for those of us, or for those listening, can you just give us like a brief background in your field?
Yeah, I'm really grateful that you invited me. I'm also grateful that you gave me an opportunity to have you on my podcast. So I really appreciate that. And I've probably been practicing medicine for 29 years now, and I am privileged to have gone from an approach where I was trained to really diagnose medical conditions as best I could. And if I got that diagnosis right, I was considered a phenomenal doctor. But then later, I realized that nobody was really healing. Most of my patients were being managed quite well with medications. And I never even thought to question, was that optimal, until I realized that there was another way. And I later learned that lifestyle was the key. And when you take that approach, then people can actually get off medicine. They literally can get off medicines in many cases. And it was kind of a aha moment. And from that moment, and that was probably about 11, 12 years ago, when I really started to focus on low carb, I shifted my medical practice from focusing on optimizing medicines and looking at people, instead, not looking at people with a side eye when they are not taking their medicines, to a model where we literally are trying to figure out, when do we start to wean you off medicine? So I became a deprescriber. And I literally had to train myself how to do that safely. For example, the guidelines for therapeutic carb restriction, which were created by Adele Height, and you can find those on Low Carb USA's website or the Society of Metabolic Health Practitioners website. They teach us how to safely take people off medicine. So it's really nice to go from one model where it was managing to a new model where we actually now get people off medicines and help them heal. So it's changed how I practice medicine. It's changed how my patients perceive me. And we celebrate almost every, day victories of people who are doing better. Their kidneys are better. Their blood pressure is better. Their need to take a statin is better. We fix all of those things. And it's been a great gift, man. So that's why I try to teach this widely, so that more people can learn that there's another way. And the best way to heal is to use lifestyle as the key.
Yeah. But how did you come to that yourself? Like, you were vegetarian, vegan yourself, and now you've gone low carb. So what was the deciding factor there? What was the switch?
I think there were two issues. One was the research I did. When I was preparing to write a book, Fix Your Diet, Fix Your Diabetes, I needed to do research so I could have, references, right? And so the research was one issue, and then the other was just my personal experience. So I went into a vegetarian lifestyle, and I had been vegetarian for 8 years because I wanted to be healthy, and you just kept hearing the messages out there in the world that was the best way to do it. So, and it was also my kids. I had I was a new parent, and I wanted to make sure that they understood. So what I did was for my babies, it was really for me to understand. I got a book called How to Disease Proof Your Kids by I think it was by Dr. Furman. But anyway, the book was plant-based, and I just went down that rabbit hole to help my kids. But I also made lifestyle changes back then because I wanted my wife to be healthy also. So when I went down that plant rabbit hole, and I followed the advice of experts like Dr. Colin Campbell, you may know him from the China study, Michael McGregor, Dr. McDougall, and others. They just convinced me that was the best approach, which was plant-based. But then I later learned that these experts primarily relied on observational research, right? And at the time, when I started, I didn't really understand that observational research only shows possible correlation, possible causation. And I didn't understand fully that randomized controlled trials was the way to go. So once I started looking at randomized controlled trials, which show, A equals B, it shows causation, that's when I found that the vegetarian diet was inferior to the low carb diet. In fact, it was really the Public Health Collaborative and other organizations that really, in plain English, show that if you compare a low fat diet to a low carb diet, particularly for weight loss in this particular example, for significantly greater weight loss, it was basically, I think, around 39 studies that were low carb, which were superior to all the other low fat studies that were done. It was 39 to 0. So there was no comparison. There was 0 low fat studies that were better than low carb. So the first issue for me was the research did not justify me writing a book about diabetes based on low fat anymore. I couldn't do it. So I shifted completely. And what I did is I did an experiment on my kids and my wife first. And the experiment was, it was really for them and to experiment. So we did the experiment, and the experiment showed that for all of us, we felt better. My wife was able to manage her blood sugars better. But more importantly for me, I had a history of irritable bowel. And it wasn't until I did a low carb diet that my symptoms went away, and the belly pain that I was experiencing went away. The bloating that I was experiencing went away. Oh my God, the gas that I was experiencing eating all of that high fiber food went away. And of course, with irritable bowel, you can get diarrhea, and it all went away. And so, but I think if I think about all the things that got better when I went low carb and got confidence in that, I got to a point where I didn't think about, where's the bathroom? When you have irritable bowel, you're just always, where's the bathroom when you're out? And that was the number one thing that was nice. So my mental health got better because for the first time in my life, I felt normal. And honestly, I think people out there who are checking this out, if you have irritable bowel as an example and you don't know what normal feels like, I guarantee you normal is not how you're living right now. So once you get to normal, you never want to go back to not feeling normal. And I would say that's true for most health conditions. It's normal for me to have an up and down sugar. No, it's not. It's normal for me to have a high blood pressure. No, it's not. So we want to get back to normal, and normal is not living with these so-called chronic medical conditions. So for me, my wife, and my kids, man, you can't go back to not living and feeling normal. So I'm just so grateful that, like you and others, that we found a way, and it was this lifestyle where we reduced the poison, which in my opinion is excessive carbs. So it's been great.
Yeah, exactly. Yeah, I know what you mean. IBS, if you go out to a restaurant, the first thing you look for is where's the bathroom,
Right.
Yeah, it's like if you have a fire phobia, where's the fire exit sort of things. Like it's always the bathroom. Where's the bathroom? So
always, and I never have to think about that anymore.
No, that's right. Yeah. So when you went, you found all this research, and you've been a doctor for so long. You've been through medical school. You're in practice, and why didn't you know this beforehand?
Honestly, I think that we were taught to normalize the abnormal, going back to that concept. So I thought I was a really good doctor when I was able to manage my patient's disease as well, because we were taught that that's what you do. We were taught that all of these medical conditions are chronic. You really can't reverse them. I mean, literally, that's being stated not just for diabetes and hypertension, it's being stated for obesity. Well, you got to manage it. And I think that concept is what sticks to me the most, is that I didn't know that a person with diabetes can get off medicines. I never knew that, because in the 18 years or so before I actually adopted these changes, nobody was really getting off medicines, maybe a couple of people, and they were like ultra athletes and things like that. So I just think in the medical conventional training model, we're not really given the understanding that, yes, you can reverse these so-called chronic medical conditions. And I think that, so when you're living in that bubble, you're being judged by, is that patient on the right medicines? Are you optimizing their treatment? So if a person comes to me and they have, let's just say they have diabetes, but they're at risk for heart disease, obviously, with diabetes, we're going to put them on a medicine like Jardiance, which will then tell the body to urinate out the glucose or the sugar. We should be telling them not to consume those things, but instead we give them a medicine like Jardiance. We tell people that your cholesterol is high, and that'll increase your risk for cardiovascular disease. We now know the total cholesterol and the LDL cholesterol are horrible predictors of cardiovascular disease, but we're taught that we need to put you on a statin to lower those numbers and reduce the inflammation. Oh, by the way, if you do lifestyle, you reduce the inflammation and have a greater impact on reducing the metabolic markers that we look at beyond the cholesterol and LDL. So it's all about the training. We're taught to make sure people are taking the right medicine. We're not trained to teach them that lifestyle matters. And for me, after I did my own research, and it's actually a sad statement that I had to do this on my own. It's a sad statement that we're unicorns in this world, because people look at us like, oh my God, what are you doing with these keto and carnivore diets? But these are the diets that are healing people. And it was really just me recognizing that, and the medical community has not fully understood the impact. And I think if my clinical colleagues understood the impact this would have, and that you can solve many problems by simply telling people how to eat, and you just have to support them when they're making these changes. You have to give them coaching. You have to give them group support. You have to give them the diet that works, so that you won't demonize them because they're not doing well. So I think we're being taught to focus in an area that gives us very low results. And if you want return on investment, you'll find that the dietary pattern will solve many of these problems. So it's really part of why I'm out here on a podcast, or the outreach committee I chair for the Society of Metabolic Health Practitioners, and we now have a American Diabetes Society that Dr. Kim Berry is putting together. The goal is to teach people that this is possible, because the current health system does not teach us that nutrition is the best medicine.
Yeah. So why do you think so many doctors and hospitals around the world are so resistant against this movement then? If they can see, I mean, the studies are there.
Yeah.
They can see the history of like a ketogenic diet, and they can see the tens of thousands of people that are healing themselves. So why do you think they're so resistant?
Well, part of it is they're expected, I shouldn't say have to, because dietary guidelines are guidelines. They're actually not rules, right? So doctors in particular, and it's a little tougher for nutrition professionals. Like I think about Michelle Hearn, who is a nutrition professional, marathoner, who in her world of nutrition, they have to follow the guidelines more closely than maybe the doctors, but they're supposed to be guidelines. So I think doctors are married to the guidelines, number one. And because they're married to the guidelines, they think if they deviate from the guidelines that's going to get them in trouble. But I think most of these doctors have not heard of the outcomes that I really believe that. Like, they really don't know that there's a great doctor who's now deceased, Dr. Sarah Hallberg, right? Whose whole life was dedicated to teaching the world that you can reverse type 2 diabetes, particularly as she worked with Virta Health. And it wasn't just based on like anecdotal research. Virta Health did the research. They showed in their research that that you can reverse type 2 diabetes type 2 diabetes. Now, what I would say for anybody who hasn't had a chance to hear how that's possible, we actually did a legacy course in honor of Dr. Sarah Hallberg. And it was Dr. I can say doctor now because Nina Teicholz has a PhD recently. And she put that together. I was able to be one of the speakers. And we have in fact, I'm going to share the link with you, DC, where people can literally learn from experts, Dr. Ben Bickman and others, how you can reverse type 2 diabetes. So we did a legacy course, and I would guarantee you most clinicians have never heard of the concepts that we shared in that. Most of the doctors didn't know about Adele Haidt, who wrote the therapeutic guidelines for carb restriction, which you can find on Low Carb USA or the Society of Metabolic Health Practitioners website. Most doctors don't know about Dr. Eric Westman, who's been doing research on low carb since 2002. So it's been over 20 years of research on low carb. They've never heard about this concept of using diet to reverse diabetes. And why do I keep saying they haven't heard of it? Because doctors, they don't read a lot of nutritional studies. They read the medication studies. So it's out there, but they really don't know the information. The irony is that the people who have driven this conversation even more so than the experts are the patients, right? And if you think about Dr. Eric Westman, he learned about low carb from a patient or two who had come in and had great results. And he was like, "What are you doing?" And then that gave him his aha moment, and he was able to help people. So I just think my clinical colleagues in conventional medicine are not aware of the benefits, and they are living in a world where they don't de-prescribe medicines that they prescribe. And if I could say directly to them, what would it feel like to go to clinic almost every day and you're literally debating with a patient whether or not we should take them off or reduce their medicine? What would it feel like to not be a prescriber, but a de-prescriber? It would change the game, not only for that patient who's not needing to take more medicine, but how you feel about being a doctor, how you feel about being a healer. And that's, for me personally as a professional, been the greatest win. I just feel like a healer. So it's been amazing. And I think as we share this message, there will be a doctor or two, or a nurse or two, or a pharmacist or two who will hear this message and say, "Oh my God, I didn't know that was possible." and then they will then start to integrate this into their practice. So hopefully over time it'll continue to improve, because, and that's why we created the American Diabetes Society, which should be up and going very soon, because we want to help spread that message to get it out faster than it's currently being shared.
Yeah, I saw that with Dr. Berry's announcement. Actually, brilliant, absolutely wonderful to see. Now you're a specialist in obesity and diabetes, and getting people off their medications and reversing diabetes. And you've spoken for the American Diabetes Society, American Diabetes Association, a few times as well.
Yeah.
What do you think about the dietary guidelines about the American Diabetes Association does now?
Yeah. And sometimes you have to be in the space where even when you're being asked to speak, that you're honest. And I've been very fortunate in that. I remember so many times when I've spoken for the American Diabetes Association, they do give me permission to speak my truth, but I do it with dignity and respect. I recognize that some of what's causing problems is lack of knowledge. But the other piece to the puzzle is bias created by sponsors. And it's almost like politics, right? In America, it's legal to lobby our politicians. It's legal. So it's essentially legal bribery, right? It's legal. So, but then when they do studies on the behaviors of politicians, 93% of their what they do, not what they say they're going to do, is based on the interests of the lobbyists, right? So the same is true in healthcare, in that you have really good intentioned people with large organizations like the ADA and American Heart Association, et cetera. They're good intentioned, but you can't not be influenced by special interests. So, and it starts to look a little suspicious when the previous CEO, her name was Ms. Brown, of the ADA, when she shared that she had reversed her type 2 diabetes with diet, low carb, shortly after she was, you didn't see her publicly saying that anymore. And shortly after that, she wasn't working for the ADA anymore. To me, that's not just a coincidence. To me, that's a person who shared a truth, and it wasn't good for business. And I think the sponsors probably weren't too happy to hear that she was minimizing the use of the foods that they helped create, the processed foods, the cereals and the breads and the pastas and things of that nature. So it's unfortunate. But having said that, it is those types of things that lead to change. And it's possible that maybe because that was known to that organization, maybe they finally looked at the research that showed that for diabetes and weight loss, et cetera, that the low carb keto diet is the best. You then later found in 2019 that the American Diabetes Association did have to add low carb to one of their recommended dietary patterns. So in order to make change and have progress, you just have to be, committed, and dedicated to the cause, but a little patient. The key is to just keep getting the message out there and then advocate for change as best you can. So I'm really happy that things are changing, but it takes a grassroots effort to make this happen. But we're getting there.
Yeah, you're right. It really does. It takes time, and to spread any kind of message. But it seems ironic that a lot of people that you see working for the ADA actually themselves suffer from diabetes.
I know.
So
yeah, that's how they became part of the organization. They're doing it for the right reason. They're like, man, I'm dealing with this. I want to help other people who are dealing with this. But there's this disconnect between I'm getting results this way and why is my organization not focused on that? So there's bias. And again, there are great people who are working for the ADA, I'm sure. It's just that we can't have blinders on. And
Yeah.
the research makes it very clear that if you remove the thing that actually caused the the damage to the body, which is excessive carbs, you'll be able to do just fine. But you also have to remember that the things that scared us were this so-called concern about LDL cholesterol and cholesterol, this so-called concern about saturated fat. So once people are aware, those concerns have been, we don't worry about those like we did in the past. Then it gives you permission. The fact that these large organizations are endorsing this dietary pattern, then it gives us permission, particularly clinicians, to say it's okay. So we're transitioning, because a lot of these approvals for the society in America, it was the endocrine societies. It was in 2016 they made these recommendations that it was okay to do low carb. The ADA didn't do it until 2019. American Heart Association didn't do it to 2023. It takes a long time before, they put it in small print, by the way. It's in small print. So but once it's out there, it takes years before like a large health system will then adopt these approaches. So
yeah, I agree. Yeah, speaking of bias, I forget who said it, but they said, doctors and scientists should all wear sponsorships on their lab coats.
Yeah.
So you know exactly what where their loyalties lie.
Yeah, but, I think that's a good idea. Well, I'll work on that in America.
Yeah. I was talking to Dr. Robert Lufkin. He wrote the book Lies I Taught in Medical School.
Yes.
And it's a very similar story. He was the same. And he even grew up, his mother was a dietitian. And he still had problems. He had the same problems. He was vegetarian and vegan for a while as well. Yeah. And it's amazing I think for general public to understand, to realize that doctors themselves don't have education in nutrition. It's all about symptoms and management with drugs. So whenever they fall for this, especially you see it all the time. You see it on social media. People get a doctorate. It doesn't matter what kind of doctorate, but they'll make sure that that's the first line of their name, so that they can then tell people about nutrition, even though they have no idea. It's clickbait.
Yeah, that's right.
So,
but people are learning. If you think about it, people are learning about what we're talking about on a YouTube video. They're learning about it on a podcast, and again, they're just not being taught that by changing lifestyle, they can have a huge impact. It's for me, it just feels like, how could that be? But if you talk to my colleagues, if I went and surveyed my doctors, not so much at my clinic anymore, because they hear from me often and I'm able to, as a medical director, put things in front of them, but they don't even think about it. I mean, you'd be surprised if you just interviewed randomly 100 doctors, most of whom won't know any of this information. It'll shock you how they just don't have this knowledge. So again, it's just our goal to make it clear. And I am a little surprised, as you've suggested in your questions, what's taking so long. I think you're going against why does it take long for a politician to be replaced by somebody that cares about the people? Well, because you have a big machine pushing against it.
Cog in a very big machine.
That's right. It takes a minute to be, to compete with that machine. So,
Yeah, that's right. So, okay. So most of what you talk about and what you speak about is reversing diabetes, but it's still through high fat, low carb, metabolic therapy. Now, I've also seen you speaking about other diseases as well, such as cancer. So how would this relate to either avoiding cancer or treating cancer?
It's, and for anybody who knows someone with cancer or who is themselves at risk for cancer or are treating being treated for cancer, there's nice to know that there's hope. And I know we talked during my podcast when you were my guest, we talked about an episode I did on my YouTube channel with Dr. Paul Mercer. And he was phenomenal in that his team was able to kind of do the research. What does the evidence say about cancer? And it was just so nice to be able to put that in front of people. And we did it as a PowerPoint presentation, as you remember. And he just focused on like three main concepts. The first concept is that, and I think people have heard this, that cancer is a metabolic disease, and it being metabolic has a lot to do with how well our mitochondria functions. And what he found in his research, and I found too, is that a dysfunctional mitochondria is present in almost all cancers, right? But the current model of cancer is all about, mutations and that it's like some type of genetic disease, but that's only true in a percentage of cancers. So it makes more logical sense that if something's more present in all the cancers, that's more likely to be the cause that we worry about. So I think that people need to know that if you have cancer and you start treating it as a metabolic disease, and you understand that also has a lot to do with the fuel source that you give cancer. So cancer cells in particular are very interested in getting their fuel from glucose. That's their primary source of energy. So if we can reduce that source of energy, you're going to do people a big favor. The second concept in that discussion we had with Dr. Mercer, we talked about if you're treating cancer with chemotherapy, it's a good idea to consider fasting before you have the chemo, because what fasting does, which is really remarkable, is it allows the healthy cells to go dormant because you're fasting. The cells are like sleeping, but the cancer cells never go to sleep. So what happens is if you fast before chemo, what'll happen is you'll put the healthy cells to sleep. The treatment can then target the fast-growing cancer cells, and so it targets those cells more effectively. But more importantly, since your healthy cells are dormant, that they're not being harmed by the chemo. So the side effects of chemo, which is when they affect the dormant cells, it's like those cells are sleeping, so chemo won't affect it. So it really allows for a person who's being treated for cancer to do better, to have more effective treatment and have less side effects. And the last concept we talked about was that there are supplements that you can use to help treat the cancer. And I can remember some of those things. I know vitamin D was on the list. Omega-3 was on the list. Berberine was on the list, and melatonin and maybe green tea. But these supplements, along with the right keto diet, attack the stem cells. So the problem with the current model of cancer treatment is that they only attack the fast growing cells, but guess what? The stem cells are not fast growing. So now if you only attack the fast growing cells, you create a scenario where now the stem cells can later come back and harm you. And that's a problem. So with the right diet, the right supplementation, you can do really well. So it took the work of people like Professor Thomas Seyfried, who had a book about cancer being a metabolic disease. And he was able to show in his book, the principles. One of the principles is this Warburg effect that that some people may have heard of, and with that effect, you shift from this oxidative phosphorylation to glycolysis. This is what cancer cells do, and the problem with that is glycolysis yields you only like 2 ATP or 4, that's adenosine triphosphate. So it only gives you 2 ATP, which is a source of energy, where oxidative phosphorylation gives you 30 to 36. So cancer cells, for some reason, prefer this glycolysis pathway, which is very ineffective. And that so cancer cells, if we starve them of glucose, will take away their primary fuel and they will suffer. So I think these kind of concepts are important, so people will know, yeah, you can actually treat cancer without just focusing on procedures and chemo. Can you do those two things together? Absolutely. Is it a good idea to do those two things together? Absolutely. You put all the troops on the field at the same time, and you have to be very aggressive with cancer. But to treat it without focusing on lifestyle is doing your body a disservice. And not only are you going to help fight cancer better by being on a keto diet, as an example, what happens is you're also going to heal other parts of your body. You're giving your body the right fuel so that as you're kind of building your muscle, those essential amino acids and fatty acids will be present. So I just think people need to understand that there is another way. And again, if you ask the average clinician, had they even heard of any of this, they would say no. So we have a disconnect between where we are and where we need to go. And it can be a little frustrating that my doctors who treat cancer don't integrate lifestyle into their treatment plan. They may refer a person to nutrition, but that's as far as they go. And we need to do better than that. We need to make this the primary way we treat cancer. Of course, we're going to tell people not to smoke and not to, drink excessive alcohol. Don't eat processed food. Make sure you exercise. Make sure you get enough sleep. Make sure your stress level is low. These things matter too. But we have to integrate all of these things into our teaching.
Yeah, I agree. Lifestyle is a big, it's a very large, I think, very large part of it. And I think it's kind of daunting for some people too. They don't want to make a lifestyle change. For example, when I was going through treatments myself, I was sitting there with the bags hooked up to me with my arms. I would literally watch people wheel their treatment outside the hospital so they can have a cigarette. It was like, why even bother? To me, I was just thought, it's just crazy. Why would you even try to treat yourself if you're just going to keep poisoning yourself? But at the same time, the hospital were feeding everyone, cakes, cookies, and soft drinks, and so it's basically doing the same thing.
That's right.
You're still feeding it, and because, like you said, they think they treat it, or they think of it as a genetic disease. The first thing they tell you is that there's nothing you can do about it.
That's right. That's right.
So right from the start, it's a very negative sort of outlook. And when I was listening to you with Dr. Paul Mercer, is it? He was saying that there are, you have genetic dispositions, but that doesn't mean that you're going to get it. It just means that you are more likely to get it with a bad lifestyle.
Yeah.
So if you correct your lifestyle, even if you have a genetic predisposition for a certain type of cancer, you can still avoid it. Is that right?
You can. And it's so it's like anything in life. There's a lot of foundational things that put you on a path to be in a certain position in life.
Yeah.
But the good news is, and one thing I like about the country I live in is that no matter where you start off, you can end up in a pretty good spot. You have to kind of know how to get there, but there's no barrier for you to be successful in America. It's just no barrier. Now, the question becomes, will you get the knowledge to get you to the right place in time? And I think that a lot of times people don't get the knowledge, they don't get the understanding, but there's no reason why. I remember a nurse practitioner who worked with me, and she could list like 35 people who had diabetes in her family, but yes, she didn't have diabetes. And so what did she do different? Her lifestyle was completely different than her family's. And she didn't eat the foods that were spiking her blood sugar. She actually was into meditation. She exercised at least 2 or 3 times a week. She prioritized sleep. And again, her dietary pattern was one where she just reduced the poison. So she didn't consume excessive carbs. So she has the exact same genes of many of her family members. If I were to be personal, my dad had high blood pressure in his 20s, my biological dad. And I have not, I'm 50, I'll be 56 this year, and yet I have not seen any evidence that I'll have any issues with my blood pressure. So I just think that people need to understand we need to control our controllables. There are some things that that make it more challenging for you. And that's okay. We have to take the cards we've been dealt. But what are we to do? Are we to not then act on the information we're sharing today that you can actually prevent that from happening in spite of your genes? If there's one example of a person who can do that, then that's enough. There's enough examples of people who have been able to achieve metabolic health, where they're not worrying about their blood pressure, their blood sugars, and the other metabolic things that we measure. And they're doing just fine, but they have a lifestyle that allows for that to happen. So as long as somebody's motivated, doesn't want to spend the rest of their lives on pills, and know what to do, they'll be able to do much better. So it's really, again, it's a message of hope. And our genes are influenced by our environment and our lifestyle. Yes, where you live matters. What you eat matters. But you can control some of these factors in a way that you've never thought possible. And that's why I think it's important that we get the message out that your genes are only, I would argue, 10%, maybe 20% of the equation. The rest, that 80%, 90%, you have complete control over.
Yeah, I agree. I was the same. Like, even working in the fitness industry, people would always complain about being obese, for example, can't lose weight and things like that. And the usual complaint is that it's genetics.
Right.
It's a complete lie. Genetics, when it comes to obesity, maybe 10%, as you said. The rest of it's all lifestyle, and that's what I always told people. In my family, for example, I have always been the healthiest when it came to following the guidelines, the food guidelines. Eating, low fat was, my regime for many years. And, in my family, a lot of them are quite obese. A lot of them are, they do have diabetes and they have other problems, but no one has cancer. So, they tell me it's a genetic disease. And there's nothing you can do about it because it's genetic. Well, it just figures to me, if it was genetic, my bloodline would have died out a long time ago.
That's right. That's right.
That's the way we evolve. When a line of genetics is bad, it throughout evolution, it just gets weeded out. That line will die.
That's right.
That's that. I just don't see a lot of the argument behind that. But as you said, like, it's the same with the guidelines and everything. Like, it's a dogma that we've all been raised on, and no one sort of thinks about it too much either until the idea comes out. And like you said, Professor Seifert, actually, I spoke to him last year. great guy.
Yeah.
They even said, like he said, at least 80% of cancers can be prevented with
Yeah.
lifestyle change. Yeah. Unfortunately, lifestyle. When you tell someone that you have to change your lifestyle, it's a bit daunting, and a lot of them don't want to do that.
Yeah. It's more daunting to have somebody in front of you who is on the verge of dialysis, and when you think about dialysis, which is primarily caused by high blood sugars, diabetes, the number one cause, they have a 5 to 10 year life expectancy once they end up on dialysis. So I think it's harder to end up on dialysis. It's harder to imagine a life where you are not able to maintain your cognitive function, and your family has to help take care of you for the balance of your life because you have type 3 diabetes, or other known as dementia. It's just harder to have uncontrolled blood pressure and have to take a bag of medicines, which, among other things, causes erectile dysfunction and side effects beyond that. That's harder. It's harder to live a life where your blood sugars are high and low, and you can't control them because you're not eating the right food. So you spend your whole life worrying about a high and worrying about a low. That's harder. So I just think, you see what I'm saying? It's like, it's harder. And I think what we do is we say, it is hard, so we're going to support you. It's hard, so we're going to give you a coach. It's hard, so we're going to get you into a group because you have processed food addiction. It's hard, so we're going to have a clinician who's empathetic and who's not going to demonize you when you struggle. So we expect you to struggle. We expect it to be hard. And if you're one of those people, most of my patients do just fine when you encourage them. But for those who struggle, we have other things we can do for you to help you through your struggle, because we anticipated the struggle. We knew that that was going to be part of the equation. So I think as long as we're empathetic and we're thoughtful about how we help people, I think that we'll then remove the hard part of it, because the things that are harder are the negative outcomes of those medical conditions. So we have to remind people that's way harder.
I say that all the time. It's when people complain about carnivore diet, for example, being restrictive. Well, what's more restrictive than being stuck in bed all day? Being stuck in a chair or being stuck on a dialysis machine, as you said,
right.
That's restrictive.
That's right.
Eating once or twice a day, that's not restrictive. That's freedom. You're not tied to the kitchen, for one. But it's such a big difference. You mentioned dementia also, is pretty much just diabetes type 3. I saw that there was a good documentary actually called The Big Secret. And one of the doctors was giving a good lecture of the cause of these cognitive functional sort of neurological diseases is low-fat diets. Swapping margarine, butter for margarine, and all the seed oils and things like that.
That's interesting to bring that up. Let me speak to that briefly, because I was just talking to my wife yesterday, and my wife's dad, has dementia, and she mentioned that the doctors recommended that he eat those butter alternatives. I mean, literally, and she said he had like a pantry full of, or maybe not in the pantry, I'm not sure if you can, I think it has to be in the refrigerator, but it had all of these examples of, kind of like, I can't believe it's not butter type things, right?
Yeah.
And it's like, man, we were so misled. And again, the doctors didn't have poor intent. They just didn't know that seed oils, and when you look at those, and when you look what's in it, I mean, even today, when we went to my son's graduation, and I noticed that they didn't serve butter, but they had this alternative. And I looked at the ingredients, and it was the second or third ingredient said hydrogenated, I'm like, what are we doing here? It was hydrogenated soy oil.
How many have heard of Alzheimer's disease? It's a physician-caused disease. Mark my words. Mark my words. In the next 2 years, maybe even next week, it'll pop up in the newspaper. There's more than enough information to prove that it's a physician-caused disease. Alzheimer's disease is a disease that did not occur, even by another name, 40 years ago. It only became recognized as a disease in 1979, 25 years ago. Today, it's the number 4 killer of adults over the age of 65. If you listen to your doctor and you give up eggs and eat egg beaters, if you give up butter and eat margarine, if you rip the chicken skin off your chicken before you eat it, you eat tofu instead of red meat, the odds are you're going to get what? Alzheimer's disease.
Yeah. And it was that, and they were feeding, and I know it's cheaper, but that's, and we're still feeding.
I mean, it's
that.
cheaper because it's taxpayer subsidized. The soy industry is very much subsidized, and soy especially is the most prolific in additives. But I was listening to Dr. was it Natasha Wells? I think it was. I forget her name, but she did a really good video on the soy industry, and these soy additives and these soy oils were actually used to be sealants for packaging. And
wow.
in the 70s, they were concerned about you remember those old boxes, old cardboard boxes that had that sort of wax sealing on it?
Mm-hmm.
That was a soy product. And they were concerned about this flaking off and getting into the food supply because the boxes were carrying food because of the carcinogenic, because it's carcinogenic. And what they came up with was that's why they actually stopped putting those sealants on the cardboard boxes, because they were concerned that as a carcinogenic, it would get into the food supply. Mm. But now everything is, all these processed foods, they're all full of it.
It is generally recognized as safe in the food supply. And I'm here to let you know that soy protein isolate, soy protein concentrate, and other soy protein products have never received official safe food status. Now, how can that be? Most foods that were in the food supply prior to 1958 were grandfathered in. But here's the thing. Soy protein isolate and other soy proteins were not then used as food. They were used as binders and sealers with cardboard packaging. That's right. Industrial uses, not in the food supply. Fast forward ahead to 1979, the SCOGS Committee, the Select Committee on Gross Substances, was investigating soy, and they did not like what they were finding. What were they finding? Carcinogens such as nitrosamines and toxins such as lysinoalanines that appear in soy protein isolate as a result of modern industrial food processing methods. And here's the thing. They were not concerned about how much of these carcinogens and toxins we would get from eating soy, because back then nobody was thinking about soy as a staple food, much less as a health food.
I mean, you can't even get a meat jerky without a soy enhanced protein added to it.
Right.
It's crazy.
Yeah. They're putting it in the water, literally. I mean, it's just so many things about. And we just know soybeans are just, besides being sprayed with pesticides and things like that, they're really high in omega-6. And, and it really causes an imbalance between your omega-3 and your omega-6. And at the end of the day, it's more inflammatory. And not to mention all the other estrogenic effects it has, particularly for women, and I would argue for men as well, that are problematic. So I think, again, if we don't know this information, then we will be harmed by lack of knowledge. But if you look at those labels, it's very difficult to navigate. So if you go to your typical restaurant or the typical grocery store, many of the things that we're suggesting you don't consume will fill those shelves. That's why it's important that people avoid things in boxes as much as possible. Try to eat real whole foods as much as possible. and you'll mitigate the risk that way.
Yeah, exactly. One ingredient or two at the most. Another thing is that these carbohydrates, especially, but soy and these seed oils and things like that, they're extremely high in deuterium, which clogs your Krebs cycle, and that's when you start damaging your mitochondria. So I think that's people should be educated a little bit about that as well. But getting back to diabetes, when you're talking about diabetes, a lot of diabetics actually do develop cancers. So that would be, it's kind of like diabetes sort of leads to cancer, it's like a symptom of cancer.
Yeah. I think that if you think about being in a state where you're constantly battling glucose spikes, right? If I'm constantly battling glucose spikes, I'm also, just by the nature of what your body has to respond to, I'm going to have insulin spikes. Yeah. So, but the problem with too much insulin, we need insulin to help make sure our form of energy in the form of glucose gets into our cells. But if I have insulin spike after insulin spike, we know that insulin is going to then, it's also called the fat storage hormone. So people who have obesity tend to have a higher rate of cancer. We also know insulin is probably the most potent growth hormone in our body. So insulin makes things grow. So if I have a person who's constantly having insulin spikes, that means that they're more likely to make things grow in their body. And if that's a chronic, unregulated process, then it's likely that the things that are growing could potentially start to grow chronically, but also be poorly regulated and increase our risk for those growths to turn into something that can lead to cancer. So I just think when you think about, you could argue that if we resolve this high insulin state that many people live in, we won't just resolve diabetes. We'll resolve we'll greatly reduce our risk for cancer, going back to the epigenetics concept. So we may be genetically predisposed to cancer, but if I'm not in a high insulin state, maybe my risk for cancer won't be as high as the family member who is in a high insulin state. My risk for blood pressure is going to be reduced because too much insulin is and metabolic disease and insulin resistance. All of these things are the reasons why we have blood vessels that constrict, blood vessels that hold on to too much calcium leading to constriction, blood vessels that are inflamed, blood vessels that hold on to too much salt, which then increases the volume in our blood vessels. So our blood pressure is a too much insulin disease. And so many other conditions that you can think about because it's all blood vessels. Yeah. So we have a risk for cancer because we have too much insulin that makes things grow. We have a risk for metabolic diseases like blood pressure, diabetes, polycystic ovarian syndrome, dementia, because the blood vessels are all inflamed and irritated, not to mention the nerves. And that's why it's best, this return on investment is so high, because now you're going to do one intervention. We're going to eat a diet that reduces insulin and glucose spikes. So all of the things that we worry about, for the most part, we can reduce the risk of by simply making that one change. So it's really, in life, if you're going to be, I was telling my kids just as we were traveling back from my youngest son's graduation from grad school, and I was like, listen, guys, what you spend your time on matters. So if you spend, 80% of your time on the 20% that matters, you're going to get the results. So as a doctor, I learned, oh man, if I'm not sitting in that visit just trying to optimize medications, but instead during that visit, I'm like trying to figure out how to get them to eat better, I'll get more return on investment. And even when I'm trying to fix one problem, maybe they came in with a migraine headache, and I think the diet will help that. then they'll come back and say, man, my migraines are better. But guess what, doc? I didn't realize my belly was bothering me. My belly feels better. I don't have headaches anymore, doc. My mental clarity is better. So they'll get all of these side effects that are good side effects that will then motivate them to continue to diet. People say, doc, it's hard to do these dietary changes. No, it's harder to go back to feeling like crap. And you feel better doing this, and that'll be the motivation. We just got to get people to that point where they've actually tried it and seen the benefits. And once they get to that point, it's game over. Most people will want to stick with it. And even if they have moments of indulgence, like over the holidays, they'll, in the back of their mind, they'll say, man, I want to get back to how great I was feeling. So that's kind of one of my secrets to, if I can get people to try it, they're likely to stick with the changes we've encouraged.
Yeah. The ice cream or cake doesn't taste as good as you feel.
Right.
So,
no question.
Yeah. That's always a bit of a motivator that I use for other people as well, because they always say, well, how do I avoid these foods? Well, look at it this way, how good do you feel right now? Does that cake taste that good? And it's a lot of people, they call it cheat food. And I think that they've got the wrong mindset. Cheating is when you take a shortcut to get to the end result to your goal, like cheating on a test, for example. This stuff holds you back. This is setback food.
That's right.
So I always tell them, it's not cheating food. It's setback food. How long do you intend on spending trying to get to your goals? If you keep walking backwards, you're not going to get there. This is fantastic talk, really. Do you have any other sort of lifestyle changes? It's not just diet. There's a lot more to it. And I know diet is a big thing, especially, for example, like you're talking about the insulin spikes, for example. When people are insulin spiking, if you're in the fitness industry, average diet plan is eat 6 times a day on average. So you're spiking your insulin 6 times a day.
Right.
This is supposed to be the fitness industry.
That's right.
The health industry. It's crazy. And looking back, I'm thinking, I used to eat between 6 and 8 meals a day myself. And most of it was very highly processed seed oil sort of food. So and everyone knows the results of that. So, just a small lifestyle change can make a big difference. So other lifestyle changes that have proven effective to use, not besides diet.
Yeah. Well, for me, it starts with your brain. And I just find that for my patients, and I would even argue for me and my family, how we think about things matters. So part of what gives you time to focus on your lifestyle is making sure your priorities are aligned. So when I was working with a leadership coach, he introduced me to the Eisenhower matrix, and that's something people can Google. But the Eisenhower matrix is a way to prioritize what's important in your life. So, and it kind of has this urgent and important approach. So some things are urgent and important, and some things are not urgent and not important. And then, of course, it can be important but not urgent, etc. So part of what I think people should do is, what are your priorities? And when you have urgent, important things, do those things first. So that's the first thing I think about when I think about what other hacks can you have in life. The other thing that's important, going back to a similar approach, is, where are your priorities? So for me, it's family over work, right? So I try to prioritize my life in such a way that my family is not harmed. Even the recording of this episode with you is done early in the morning for me. my family's still sleeping, right? So there's nothing, there's nothing about this recording that negatively affects my family. I have my NEST in acronym: nutrition, exercise, less stress, more sleep, how we think. Those S's are really important. So I try to make sure that there's adequate sleep. And when I don't get adequate sleep, I try to find a way to catch up. In fact, even for this recording, because I had the night before, we did come home late because we were coming back from graduation, right? So, but normally for me, I'm going to get like 7 hours of sleep. I need 7 to feel good. I don't need 8, but I think people have to decide what that number means. So I think sleep is really important. On nights when I'm at home, I put on blue light blocking glasses to help get my melatonin up. In the morning, I put a bright light in front of me to increase my cortisol, and I make sure the room is cool. I do whatever I can to optimize sleep. I think that's really, really important. And then, and the last thing I'll say is just how you think matters, because if I have a positive perspective, that's good for my health. And I think a lot of times people don't understand why is Dr. Hampton listening to some inspirational person in the morning? He seems like he's doing pretty good. Well, I'm doing pretty good because I listen to inspirational people in the morning, right? That's how it happened, right? So let's spend some time. I know we have wars going on and we have a lot of political unrest in many countries, but let's put some energy away from that stuff towards making sure our brain is where it should be. And also just have a sense of gratitude that although I may struggle, I'm so grateful that I'm doing well in these other areas. And just be grateful, because if you can think positive, remove self-limiting beliefs, and be grateful, I think those are the tools you'll need to help kind of move you forward as you're trying to achieve your goals. So that's kind of how I take it. I think it's up here more than any place. And if we can get people to think positive, man, they'll accomplish way more than they ever expected. I mean, think about these athletes that do great things, and a lot of that is up here. What separates the really elite, really special people from others is they have the right mindset.
The attitude.
That's it. That's the attitude. Yes, sir.
Yeah. Attitude is the most important thing, I think. And like you said, it separates the haves from the have-nots. It separates us from the doers from the do-nots.
That's right.
It's all about attitude. I agree. Listen to positive messages as much as you can. Even towards a negative thing, you can still remain positive. Like, I know, like you were talking about political unrest and everything, but I think positive about it. We are working on it. We are doing something about it. We are fighting against it. That's a positive. Even though it's a negative situation, we are positively doing something about it.
That's right.
It just depends on how you look at it. And I agree. For me, at night, it's find 3 things to be grateful for from the day, and prioritize and write down 3 priorities for the next day. That's my right. Before I go to bed, I write down 3 things I'm grateful for that day, and 3 things I need to prioritize for the next day.
That's right.
And sleep, like I said, is so important. I think for your metabolic health as well, you produce more melatonin at night. Your peak melatonin production is before 12 o'clock. So always sleep. Like, the more you sleep, the more hours you sleep before 12, the better your sleep will be.
Yeah.
And I read somewhere every hour before 12 o'clock is equivalent to 2 hours of sleep. So for me, bed is 8 till 9, up at 4 o'clock in the morning. That's it. Then that's just perfect sleep for me. Yeah. And I think if people can get themselves in a good routine, they will find it a lot easier too. Actually, I did a video about this the other day. It's about setting your body clock to the circadian rhythm.
That's right.
It's so important for hormone production. and different types of light throughout the day, like first thing in the morning and into the evening and at night. So really helps.
Yeah.
Okay. Fantastic talk. Thank you very much for taking the time. I know you've got a really busy schedule, so I really appreciate it. I'd love to have you on again sometime to talk about this. This is really cool. And any parting words of wisdom for the listeners?
Yeah, I think first of all, I appreciate what you're doing as well. I think we need to have as many people out there spreading this message, and it's nice to connect it to your personal journey. So it was good to hear about that when you were a guest on my podcast. I think the main thing, I think I'll kind of circle back to resources, and I think for people who have diabetes, we should definitely have a link to the Legacy course by us for Dr. Sarah Holberg. It's free. And we had really good speakers talking about how you can reverse type 2 diabetes. Just to get, so I'll share that link with you after the recording, so that people can enjoy that. And I just would say, another thing people may want to think about doing is to get a link tree. I think we all have link trees, but the link tree would be helpful, not for you to necessarily start your YouTube channel if that's not your thing, but it's to just link people and your friends and family to content that you appreciate. So whether it's DC's or my YouTube channel, Dr. Ken Berry, Dr. Chafee, or others, make sure people have access to information and maybe that link to that diabetes reversal course could be one of the links. I'm going to actually add it to my link tree just so people have access to information. All we can do is spread this message, and we won't reach everybody, but if we can just reach a few people who would have not otherwise known this information, it will be a gift. So that's, I think for me, just making sure people have access to resources is the key. So I really appreciate you, man. And I just hope that you continue to be healthy and heal. And I'm going to try to do the same. And let's keep spreading this word.
Absolutely.